We're joined by Dr. Veer Pushpak Gupta, National Health Services. Thank you so much, Doctor, for joining us once again on the show and talking about what is being done in England to tackle the spread of coronavirus. So tell us more about this three-tier system.
Thank you for having me on the show once again, Gargi, and good morning to all our viewers on NDTV. This three-tier system has been made by the government to prevent a full lockdown. The last time we went into a full lockdown, the results were obviously disastrous for the economy, and I don't think any country can afford that at this point. So countries have to find new ways, whether it's closing schools, whether it's nighttime lockdown, or whether it's the three-tier system. So in this system, every person in the UK has an app where they can put in their postcode and check whether their area is in medium lockdown, of high risk or very high risk, and different levels have different restrictions associated to them. So very high risk would mean a complete lockdown of pubs, bars, restaurants, gyms, like the one we had before in March. And I think at the moment only Liverpool and possibly Greater Manchester and Nottingham are looking to be in that zone, but the rest of England is in the medium risk zone. We are seeing numbers go up again. We had 19,000 cases in the UK yesterday, which is the highest that we've had since COVID started, 22,000 cases in France. So we're seeing the start of a second wave, and I think governments here are now looking at different ways to try and get that R number down without doing a complete lockdown, which would be disastrous to the economies.
Right, and what about movement of people? How is that going to be? Also, what is the reaction been to this? Is the public realizing that the governments just have to do this to, protect those who are most vulnerable, or is there some amount of anger over these restrictions coming into place?
Well, the entire point of these restrictions is to protect the NHS, especially in England. We want that people should be coming in and getting the health service that they need, and to protect the health service, it's important that we start these measures now so that we don't reach the levels that we reached in March, where 42,000 people died, and a lot of them were on ventilators and in ICU. At the moment, we're seeing the death rate rise, but it's still quite low. More younger people are being infected, and they're having less serious infections than the ones we saw before. The most vulnerable have to be protected, and that's the reason that these lockdowns are going on. The public has had a mixed reaction to it. I think there's a bit of corona fatigue that has set in amongst the public as well, and amongst healthcare workers alike. But I think that these measures are important until we reach the point where we can effectively vaccinate the entire population. The other thing that has to be noted is that in these countries, especially in Europe, personal liberty and freedom is valued very, very greatly. And so governments that go against that are never going to be favorable by the public. But I think that what we're seeing right now with this second wave, these governments are being basically forced to make these measures as the numbers keep increasing. There's some things
you just have to do, with like wearing masks. Everybody, all the doctors, all the scientists have talked about, how wearing masks is something that is like non-negotiable in terms of fighting this virus that we don't have a cure for right now, don't have a vaccine again. Just finally, very briefly, the challenge for the government, because on one hand, as you emphasize, we don't want to go into a complete lockdown again. On the other hand, we're not going to go in for this herd immunity theory either, because that's also very dangerous. So it's going to be quite a risky, middle path that governments have to take.
Yeah, and that is a challenge that all governments are facing at the moment, especially in Europe. How much can you tell people what to do? How much will people follow? And how much would you have to make restrictions very, very strict again and curtail the liberties of the people? And that has to be a fine balance. And that's why, as you mentioned at the start of the show, some countries are closing schools. Some countries are doing nighttime lockdowns. In the UK, we've started this new three-tier system where limited lockdowns will be there in most cities, but very strict lockdowns in the cities that are highest infected. And I think going forward, this will be the system that will have to be followed in most countries.
Absolutely. Thank you so much, Dr. Gupta, for speaking to us here at NDTV.
Thank you very much.